very much indeed, Chairman. And I welcome the fact that there will be some less charges, Minister, in hospitals going forward, and that's a welcome move. And obviously, if there's more charges, we'd appreciate getting rid of. But I will say one thing in fairness: Bantry General Hospital, there's ample parking there, and there's no charges, which is very, very fair to the people, because it's a hospital that's used so much, but could be used a lot more. And that's the sad thing, Minister. That I've heard of ambulances and patients telling me that they're for small breaks and stuff like that from Castle Dunbear and West Cork and places, driving past up to CUH, up to be landed above and side in the back of an ambulance for half the day waiting, when they could be looked after down below in Bantry General Hospital. It's sad that he destroyed the overnight section of it, but even daytime you're trying to avoid taking people into the hospital there, which is a terrible thing. And I have an opportunity to talk about different issues here, because it's health issues, but the respite beds in community hospitals. And I'd like to ask you, Minister, what is happening with our community hospitals? A lot of people are looking for respite beds and they can't get them. I have a family here that give me 4 pages of attention they have to give to their mother, and they love their mother, but they were going to a wedding recently and were promised respite in a hospital in the eastern end of my constituency, community hospital, and were rang 2 or 3 days before, told that the respite was withdrawn because they hadn't enough staff. So we have a staffing crisis in our community hospitals, from what I can gather. And also then, I people coming into my clinics, and especially last weekend, I had a lady that had a very sick child, and she rang South and they had to wait between 3.5 to 4 hours before they could be seen. So there's a lot of problems in our hospitals. And I mentioned one issue to you last week. The government has given 2 dates on which the Rivotril drug was due to be back in stock in pharmacies nationwide, March the 13th and March the 19th. These 2 dates have come and gone, and still no sign of this very essential drug, which is so vital for thousands of patients suffering from Parkinson's, multiple sclerosis and epilepsy and other neurological diseases. We are now being told that it is due to be back in April the 2nd. However, patients urgently awaiting this drug have lost all confidence in the government announcement on this return. And Minister, maybe you might be able to give us some clarity on that, because you did ask me to write you, and I did, and I still haven't got the clarity that we need on that, on the Rivotril drug for Parkinson's patients. Thank you.